She presents tired eyes with a very important presence of dark circles. Although she's very young, when I analyze her in the oblique view, I already notice the presence of heaviness in her nasolabial folds. She presents an empty space at the level of the parotid area. And when I analyze her in her oblique view, I notice the presence of volume loss at the level of the upper maxilla. When she tilts down, I notice that the cheek drops, meaning that she would benefit with the treatment of lifting of her cheeks. When I analyze her in frontal view, she's very beautiful. I ask her to smile, shall. We notice the presence of deep nasolabial folds and heavy cheeks. So ideally, I needed to rotate the cheek up to make it less heavy over the nasolabial folds. Now, let's start with the marking. We asked the patient to sit up and let's identify, zooming now, the marking. It's very important to ask the patient to look up. Marking the transition, eyes up, and again, take a look in L1, L2, L3, and L8. Let's start with cleaning. Stretch to improve the nasolabial fold and inject. 0,1 in L1, then 0,2 in L2, then 0,2 in L3. Tá um botão? Now observe that only with injections of L1, L2, and L3, take a look how the line changed position. We also notice less nasolabial folds. Smile. Take a look on the treated side. The nasolabial fold is less evident. Now, take a look what has happened when she tilts down. The nasolabial fold gets less important. When I look in the oblique view, I also need to go to L8 to reduce the nasolabial folds. Now let's proceed with L8. We have to pinch and enter with the needle, making a round movement. Taking it up, getting very slowly so that we do not get pain to our patients. very slowly movement so that there is no discomfort for our patients. Now I'm injecting with a fanning technique. And creating support to the nasolabial folds. Inhale 8, we inject 0.8. Now we notice that after injecting L1, L2, L3 and L8, we notice that there is much less heaviness over the nasolabial fold. We see the change in the eyebrows, eyes, and also at the level of the lower face. Smile. When the patient smiles, smile more. We see that now the cheek is less heavy, so we don't see too much smile, nasolabial folds. Now let's work on the contralateral side. L1, L2, L3 and L8. All of these points is to reduce heaviness over the nasolabial folds. Now let's do the same. Start with Juvederm Ultra Plus. Injecting 0.1 in L1, 0.2 in L2, and 0.2 in L3. So now let's proceed with L8. Cleaning is very important. Taking and pinching the skin so that we can insert the cannula. Gentle movement so that we can progress with the cannula anterograde. Zoom out. Zoom out. We can see that even without lidocaine, this procedures is well received by the patient. The secret is inject slowly without promoting pain for the patient. Zoom in. Now, let's improve even more her nasolabial folds, getting to her a beautiful teen look. To improve the nasolabial folds and to highlight a very much improvement in the points to improve even more her nasolabial fold. So we want to reinforce this beautiful area, smile, to improve even more the nasolabial fold. Let's go in CK2, inject deep, and inject a total of 0.2 ml. Gentle massage. So now, after injecting her right hand side, let us see when she smiles. Smile. Take a look how beautiful she's getting and looking younger and younger, like the teen look. Let's go to the other side. Let's inject in L2. So now, with the injections of L1, L2, L3, and L8, we saw a very interesting look to this patient, both at rest and also when she smiles. Smile. We see that very naturally she presents a beautiful smile and a younger look. Now, after doing the indirect approach, it's time for us to work on the direct. Smile. We still say that when she smiles, it still deepens. So let's go with Ultra Plus. Zoom in. Zoom in here. And a 101, and a 201, and a 3005. Let's see what happens after NL1, NL2, NL3. Smile. More. We see that the nasolabial fold reduced. Let's proceed to the other side. Relax. Zoom in. Close our eyes. So this was the immediate result after injecting L1, L2, L3, and L8. We saw already an improvement indirectly of the nasolabial folds. And then I asked her to smile, and still it was slightly prominent. And I finalized with Juvederm Ultra Plus along the subdermal plane. And you see that immediately after, she looks natural, both at rest and also on animation. Smile.